Hi, everybody. Thanks very much for joining us today. My name is Sarah Harlock. I'm the Program Director for the Integrative Center for Memory at DENT Neurologic Institute. And today we're going to be talking about safety and safety implications in dementia care. It's a really important topic, but I want to make sure that we're starting on the same page. And we use the terms dementia and Alzheimer's and memory loss interchangeably. So I want to make sure that people understand that there are differences. The term dementia itself really means difficulty with thinking, but it's not just about memory. And we very often think that it is related to memory or memory only, but it might be that somebody is having difficulty with language or somebody is having difficulty with executive functioning or sequencing things, judgment. All of these kinds of areas of thinking can be affected by dementia, and there are many different types of dementia. And so I think it's important that we realize this because every person who has dementia is different from the next person, and also each type of dementia manifests itself a little differently. So the most common type of dementia is Alzheimer's disease. And that one's sort of hallmarked by short-term memory changes. But there are certainly a lot of other conditions that also cause dementia, including Lewy body dementia, which people may have visual hallucinations, but their short-term memory could be fine. People who maybe have a personality variant of the frontal temporal dementias. And so that person, again, may not have memory issues, but may have personality changes. Somebody who has a language variant of a frontal temporal dementia may not have personality changes, may not have memory changes, but may have a significant difficulty with language. So there are many different types of dementia. I think it's important that people understand the diagnosis so that you can understand how they might be different from one another. And this really is important when we're talking about safety too, because the safety measures that we might put in place for one individual with Alzheimer's disease, for example, might be very different than the type of precautions we would take with somebody who has a different type of dementia. So again, I think having some basic understanding of the diagnosis and then being able to know the person that you're helping support or provide care for is really critical in coming up with the proper safety measures. I do want people to start thinking about safety before it's actually an issue, but what I don't want to have happen is people to watch this presentation or read something about safety and then rush over to their loved one's home and start making radical changes that end up upsetting the individual or confusing the person with dementia. Really, it's about balancing independence and safety. And I appreciate that that's actually a very difficult thing to do. Easy for me to say, a lot more difficult for people to actually accomplish. And so I think it's also important that we be thinking about how dementia can change the brain and what sort of experiences change for the person with dementia, because that will also provide you with some insight into the types of safety precautions that you may need to be thinking about. And it may be that you don't need to make changes now, but down the road, you may need to be putting some things in place. So again, understanding how dementia changes the brain can help you understand the types of changes you may want to make or may need to make in the future. Things to be watching for, really. So some of the changes that can occur with different types of dementia include sensory changes. So people very often have changes to their vision. They may not be able to see as clearly. They may have trouble discriminating colors quite as easily. They may have difficulty with depth perception, and also their field of vision changes. And so again, these are all changes to vision that need to be considered when we think about safety. For example, if somebody is having difficulty with depth perception, they may not be able to differentiate or appreciate how far the step down is, which obviously has some implications for falls and that sort of thing. So Vision definitely can play a role, but hearing also plays a role. And so very frequently we deal with people who are having hearing loss. There are some other conditions related to hearing or symptoms related to hearing and dementia, but for the most part, what we frequently see is hearing loss. And so obviously, if somebody has hearing loss, they may not be able to hear a timer on the stove. They may not be able to hear a pill dispenser alarm going off. They may not be able to hear a fire detector or smoke detector. So again, hearing can certainly play a role in safety as well. And then touch. Sometimes people with dementia have a diminished sense of sense of touch as far as determining temperature. And so they can sometimes burn themselves by not realizing just how hot something is. Another common situation that happens in folks who have dementia is that their feeling in their hands and feet can change. And so they may not have as firm a grip, or they may not appreciate that they're not holding something as strongly as they believe they are. And then also when it comes to walking, they may have a different sense in their feet, which make them a little unbalanced. So again, implications for safety. People often have physical changes as well. And so we often see fatigue as an issue. Somebody may just not be able to walk as far as they used to, or they may get tired earlier in the day, which puts them at risk for accidents and injuries. But balance is also a very significant change that we see in people with dementia. Again, dementia affects the brain and different parts of the brain, and so it can affect balance as well. So again, we need to be watching for changes in that. Certainly memory changes are evident in a number of different types of dementia. And so if somebody is having short-term memory changes, that can have implications. Again, maybe walking away from the stove with something on it, or somebody may say, you know, wait right here, I'll be right back. And when that person is out of sight, if they have short-term memory challenges, they may have forgotten that that's what the instructions were, and they may wander off. So again, short-term memory certainly can play a role in safety. There are also judgment changes that very frequently happen in folks with dementia, and that can manifest itself in a number of different ways, really. Some people become very susceptible to scams. They may start giving out very private information over the telephone. They may answer the door and let strangers into their home. They may become very susceptible to in-person scams. You know, being charged for a new roof and being charged, you know, double or triple what the actual price should be. Any other home repairs or things like that. So there are a number of judgment issues. Also, it may be that they're not able to prepare food safely. They don't realize that they've allowed something to stay out on the counter for a long period of time, and it may no longer be safe. Or they may even have it in the refrigerator, but again, if they are not using good judgment, they may not realize that it's not really the safest thing to eat anymore. So judgment certainly can play a role here in safety. And then changes to somebody's sense of time and place. Again, this happens in some dementias, not all dementias, but some people move back in time. And so they may not realize that they're 84. They may feel in that moment that they're 44. And so the world that's in front of them isn't really matching the world that's in their mind. And so that can lead to some safety issues. For example, if somebody feels that they need to get up at 4 o'clock and they wake up at 4 o'clock in the morning and they think, okay, I've got to get to work now. They don't realize that they haven't worked in 20 years, but they still feel that they need to be getting up. That's their routine. That's what they believe is appropriate. Or it's dark outside and they're not sure where their children are. That can certainly lead to some unsafe behaviors. They think that their children are young and should be at home with them, and they're not. So that can certainly drive some unsafe behaviors. Um, some people don't recognize their own neighborhood, so they may be driving still and have difficulty with navigation because they don't recognize some of the streets and so on, even though they may be very familiar to them. They may not in that moment recognize where they are. Or some people actually may not recognize their own home. They can be in their home and saying things like, I want to go home now. I need to go home. It's time for me to go home. And not realize that this is the house they've been living in sometimes for the last 30 years. So again, this idea of sense of time and place varies in an individual with dementia. And so in certain moments, they may not recognize where they are, or they may not recognize how old they are. And this can certainly lead to some challenges with safety. And one of the other big changes that can happen in individuals with dementia is the changes in their emotions. And so if somebody is very anxious and you can sort of see and sense this anxiety rising in them, that can very often lead to some very unsafe behaviors, particularly wandering, but we'll get into some of the other things as well. But certainly anxiety can drive some very unsafe behaviors. Feelings of suspicion or paranoia also can cause people to do unsafe things. So it's really important that we be mindful of, how somebody's emotional state is, and obviously fear. Fear can drive all kinds of behavior. So we want to be really mindful and watching and seeing that somebody's emotional state is stable and that they're comfortable. There are certainly other changes that happen to individuals who have dementia. Not everybody is going to experience the things that I've listed off here, but there are other challenges that they may face, and there's not enough time to list all of them. So, but these are certainly some very common challenges and changes to the brain that can cause some unsafe behaviors. So, what we can't cover all of the safety issues in this short session, but I did want to touch on some of the most common challenges that people experience and things that I want you to be thinking about. Again, you may never experience these, but I would like you to at least be thinking about some of these changes and some of these safety issues. So wandering is one of the biggest concerns. This is the statistics are that 6 out of 10 people with dementia will wander at some point. And it's a very difficult one to monitor. It's, again, we're balancing somebody's independence and their safety. And it could be caused by a number of different reasons. It could be caused by changes in time, their sense of change in time and space. So again, if they think that their children are young and it's dinner time and the children aren't there, that may cause them to go out looking for their children. If they're very anxious about another situation, that can actually drive some wandering behavior. Another certainly could be that short-term memory changes. They've sort of forgotten that they are on a certain task, and they are then distracted and leaving to go and accomplish something else. So the wandering can happen for a number of different reasons, and I think that it's important that you be mindful of it, but again, we're balancing their independence and their safety. Some people, are really cautious about allowing people to go for a walk, but the patient has not demonstrated any unsafe behavior at this time and has always made their way home in a reasonable amount of time and so on. So we want to think about strategies that can allow someone to still be independent, but be mindful of the safety implications. So for wandering, certainly looking for those red flags. If somebody talks about their children as they were young children, as if they were young children, or they talk about needing to get to work or go to church on a day that's not appropriate for them to do these things, or maybe they're retired, that's sort of a red flag that you need to be thinking about wandering a little bit as a possible concern. Certainly, you want to make sure that the individual has enough exercise and that they also have meaningful activities throughout the day. They may not engage in an exercise program, but if they can at least go for a walk or they can do chair exercises or something like that, that will help expend some of the energy. It also helps deal with some of the anxiety that people feel, and just helps settle them down a little bit. Meaningful activities, these are things that they do in their day-to-day, whether that are appropriate and meaningful for them, can be very, very helpful in alleviating some of the concerns around wandering too. So if we keep somebody engaged throughout the day, I don't mean high energy activities all day long. I mean having them fold the towels, having them engage in activities that they would normally do. If they're helping out around the house, if they're doing yard work, if they're doing some gardening, if they're doing sorting their tool bench and cleaning off their tool bench, that sort of thing is all very meaningful and appropriate to certain individuals. So those types of things help expend energy, but also keep anxiety levels a little bit lower too, because they're engaged in something purposeful and meaningful to them. So you want to consider something like that. I also would encourage you to look at things like safe return through the Alzheimer's Association or an ID bracelet of some kind. These are available, and I encourage you to contact the Alzheimer's Association to find out more, but they're an ID bracelet that indicates that an individual, it doesn't give it specifics about a diagnosis. What it does is it sort of indicates that you can call a number and they will contact the appropriate people who will assist this individual, so family members usually. There are also GPS devices available. And again, if somebody is still driving and not had an issue with their driving skills and not had an issue with getting lost, but you're maybe getting a little more worried or they're a little less confident in their navigation skills, there are GPS trackers for the car. There are also devices that people can carry with them. The challenge is remembering to carry them with you. So again, the GPS devices that you carry with are effective for some people in some stages, but not necessarily foolproof. There are also GPS insoles for people's shoes. That's another option for people. But I think sometimes we just get to the point where individuals need constant supervision, and it's trying to find that balance again. There are also, again, programs and services that can help keep people busy and alleviate some of those concerns around wandering as well. Medication management is another safety concern. People may manage their medications very, very well, but as their disease progresses, they may struggle with that. Again, if somebody has some difficulty with their sense of time and space or place, they may not realize that today is Wednesday, and that they, as they go to their pill box, they may not realize that, or may not be taking their medications out of the right boxes. If they've had short-term memory challenges, they may have forgotten that they already took their medicine, and they open up the bottles and take their medicine again. So again, these different types of changes to the brain can cause different kinds of challenges for the person managing their own medications. Some of the strategies around that include using pill boxes if that's helpful to the person. Pill dispensers, these are little, well, they range from very small to very large and elaborate machines that will spit out the medications at the appropriate time and set off an alarm so that the patient knows it's time to take their pills. Again, we talked earlier about some of the sensory changes. If somebody has hearing loss, they may not be able to hear the alarms on the pill dispensers. Some people will try to work with the physicians to try and get the medications all done at one time of day. So a family member could be present to ensure that the medications are being taken, or perhaps it's an aide that's been hired to come in and make sure medications are being taken at the right time of day. So again, there are different strategies for that. There are also, you may have seen some ads for them lately, they're either blister packs. So medications will come on a card and it'll have, you know, morning, afternoon, evening across one side and the days of the week down the other side. And all of the medications that are to be taken on Monday morning are in one little blister, and you just pop that and then take those pills. So you don't have to worry about bottles and things like that. Again, the patient needs to know what day of the week it is. Maybe that's a family member or a friend calling to say it's Monday morning, it's time to take your medicines. That can be effective for some people who are maybe needing just a little bit of support around their medication management. So each person will handle this a little differently, and it's about trying different approaches to find something that's safe for the patient, but also appropriate for the patient. And that early in the process, some family members will just sort of monitor when refills are needed. And so they may know that mom needs her refills in 3 months, and when that time period ends, they just sort of check to see where mom's at with her medications. And she has a lot of extras, or she's informing you that she's run out of things before the refill date. Those are signs that maybe a little more assistance is needed with medication management. Another very common concern is the cooking and household safety and so on. Again, often caused by short-term memory changes. An individual may start a process. They may put something on the stove or put something in the oven and then walk away from it, get distracted, start another project, and forget that they've actually got something on the stove cooking and so on. So that's certainly a big safety concern. But judgment is the other issue. I talked a little bit earlier about not realizing that something's been defrosting on the counter for 2 days, or that something has been in the fridge for longer than it should be. And so these are certainly cooking concerns related to judgment. I did recently have a caregiver tell me that his father had put a roast in the oven and was starting to bake this roast, or roast the roast, and had not taken it out of the plastic wrapper. And when they asked why he didn't, he said, the instructions didn't tell me to take it out of the wrapper. And so this again goes to a judgment issue and being able to understand sequencing and that sort of thing too. So again, these changes to the brain can cause different sort of responses, and not realizing the safety aspects of certain things. So again, when we're looking for strategies around that, if somebody's in the very early stages, reminding them to use timers or to carry the kitchen timer with them to whatever room they go to, can allow them to continue to cook but not forget that they've got something on the stove. For other people, using services like Meals on Wheels, or having families and friends prepare foods for them. There are also a number of meal services out there that provide healthy frozen meals So that's certainly an option for some people. Um, and then, using a combination of services and programs. If somebody's appropriate for an adult day program, most adult day programs actually provide 1 to 2 meals, breakfast and lunch. So that would reduce the need for cooking as well. So if they're appropriate for that kind of program, that might be a great way to reduce the risk of having them cooking when it's not safe. Having aides or companions coming in and helping with meal preparation can also be very effective. So again, just sort of taking the role of cooking. I don't want to take the role completely away from the patient. If they enjoy cooking, then maybe they could cook with another person, whether that's an aide or a family member. So again, if they can participate in things, we want them to participate in things, but they may just need a little bit more oversight as far as safety goes. One of the other really big concerns that gets raised are the risk of falls. I will say that even when the patient has not had any falls, the family members tend to be very, very concerned about it. And again, if you think back to what we talked about around some of the changes to the brain, including sensory changes and physical changes, that certainly can impact falls and the risk of falls and so on. So again, if we're having vision changes and we're not able to see things as clearly, we may not see that there's one more step. If we have changes to our balance, or maybe our sense in our feet is not as acute as it used to be, and things just sort of feel like you're walking on pebbles anyway, you may not realize that there's a rug coming up or an uneven floor surface. And that could lead to falls as well, again, because of the sensations that they have in their feet. Certainly fatigue and balance issues are going to play a really big role in falls as well. So all of these things can certainly affect people. Color discrimination. Sometimes people with dementia will really struggle with a shiny floor going to a rug or something like that. They're not quite sure what to make of the glare and that sort of thing. So that can create some concern and some difficulty. So strategies around reducing the risk of falls would include obviously some exercise and balance programs and things like that. There's certainly programs at senior centers and adult day programs incorporate exercise daily because we realize how important that is. But there are also things that you can do at home. And so some people may not be able to get out to attend these classes or programs. So doing some exercises even in your home can be really helpful. It could be chair exercises. It doesn't even have to be standing exercises, even chair exercises. Anything that helps strengthen your legs and your core can help with balance. Additionally, if you're in an apartment and it's hard to get out, so we're here in Buffalo, New York area, and sometimes sidewalks are just not passable. They might be icy and things are slippery and so on. We don't want people taking the risk. So walking indoors can be really helpful too, whether that's actually moving in place or whether that's walking up and down hallways. That can be a form of exercise as well. So it doesn't have to be a big, elaborate exercise program. Simple exercise can be very, very effective. So we encourage that. There are also, as I mentioned, some Tai Chi programs that's been shown to really significantly help reduce the risk of falls. So things like that can be really helpful too. Reducing or removing any of the obstacles or tripping hazards. Some patients really don't want things changed in their house. They like it the way it is. But if there are a lot of throw rugs there, it's really important that you start looking at those and either taping those to the floor or removing those, because some some of the changes that we see in different types of dementia include changes in gait, so they may walk differently. So they may see more shuffling, which puts them at a higher risk for tripping on things as well. So again, removing those tripping hazards like throw rugs and extra furniture. Sometimes people have a very cluttered environment. But if they're having trouble with walking or balance, or maybe they're even using a walker now, it may be necessary to make the pathways larger and clearer for people. So thinking about that environment is really important. One of the other things that families very often worry about, even if there's been no evidence of a problem, families will very often worry about stairs. And so one of the things that you can do with stairs, again, we talked about, depth perception and visual discrimination, being able to see the edge of a step, and that sort of thing can be very difficult. So some people have taken very colorful duct tape and just sort of put that on the edge of the step so that the patient then can see that there's something different. And they realize that they're coming up to the edge of the step. So something like that could be very helpful too. And then ensuring proper footwear. Again, making sure that it fits properly, that it's safe for the person to move about, and so on. Slippers can be slippery, so you want to make sure that people are in safe, appropriate footwear. There are certainly a lot of other safety concerns and so on that arise, and I would strongly encourage you to reach out and ask questions to your healthcare providers, to the Alzheimer's Association, to your local Office for the Aging. They have a number of different services and supports and so on in place. So again, there are resources for safety concerns and safety evaluations. I know one of our local offices for the aging actually has a safety evaluation that they will come in and provide. I know that there are also physical therapists that I know that will come in and provide home assessment care as well. There are also devices. They're called a personal emergency response system. They call them PERS for short. But these are the pendants or the bracelet-like gadgets that people wear, and then when they fall, they can push a button and call for help. One of the challenges in caring for an individual with dementia is that they may not remember to push that button. They may panic, or they may just forget that they're even wearing that pendant or the bracelet. And so they now have created some that will automatically detect a fall. So you don't have to rely on the patient to push that button. It will detect that fall and then call the appropriate numbers to get that person the help and support that they need. So just knowing that there are supports and services out there, I encourage you to talk to the doctors, certainly anytime you're seeing changes, and they can help you work through some of the safety concerns and so on. And as always here at DENT, we're very happy to help you with that too. So I want to thank you very much for joining us today. And if you're looking for more information about Facebook Lives or classes that we're teaching here at DENT, please go to our website, and you'll see things posted there. And then of course here on Facebook, you'll see them listed as well. So thank you very much for joining us today, and I hope you have a great rest of your day.